Hi everyone, I'm Tom Guo. I work in National Taipei University of Nursing and Health Science as an assistant professor. My majority is medical informatics. The courses I teach is artificial intelligence, machine learning, and statistics. Today, I will give you a brief introduction related to AI and smart healthcare. Before we start today's introduction, I will give you a brief introduction about Graduate, Graduate Institute of Artificial Intelligence and Big Data in Healthcare. At the beginning, I would like to introduce faculties in our Graduate Institute. We have six professors teaching different disciplines in the Graduate Institute. And they teach different disciplines, including R, Python, and statistics, and artificial intelligence, machine learning, and other courses related to artificial intelligence or big data. And this is the curriculum planning in our Graduate Institute. And we can separate the courses in several parts. The required courses and the elective courses related to big data in healthcare and artificial intelligence. And the final part is master thesis. And in our courses, there are 15 credits for required courses. And before graduation, you have to take all courses. And in the elective courses, we separate them into big data in healthcare and artificial intelligence. And you can take these courses depends on your interest. And then the final part is master thesis. Each student had to finish the thesis before graduation. This is a requirement. And now we'll talk about the AI and smart healthcare. And this is a report from the McKinsey Global Survey on AI. And about 1,060,000 participants at all levels of organization. And this is the report show how percentage of respondents they use AI in their organizations. In 2017, only 20% of organizations adopt AI in their works. After 2017, more than 14% of the organizations that have adopted AI. And in 2023, we can observe that more half of organizations use AI in their work, and there's about 33% organizations use generative AI. And in the last year, 2024, the 72% of organizations use AI in their work, and more than 60% of organizations use generative AI in their work. We can observe that the generative AI can increase the percentage of organizations using AI in the business. And this is another report in the 2020. And we can observe that there is a very huge market size of AI in the healthcare application. And the top one is patient data and the risk analysis, about 18.9%. And for the healthcare market, we can also observe the medical image and the diagnostics and the inpatient care and the hospital management. There are more than 10% percentage used in health application. Now we back to 2017. The Alpha shock reward in Golden, and the artificial intelligence has been noticed and is beginning to integrate into various industries. For example, the self-driving car, the healthcare, or the finance. And we adopted AI in our field now. How about healthcare industry? And we can observe in the previous slide, and he have a very huge market size in healthcare application. And machine learning is a key driver of AI. And the best concept of AI is enable machine to think like humans. And the machine learning is the key technique. It can change the machine to get back at the task without programming first. In the past, we need to teach a machine how to make decisions by programming. For example, use the if-else. Now, if we have a data, we can give the machine and teach it and tell them they can learn from the data and make a decision for us. What's the benefits of AI in healthcare? And there are 4 benefits we will introduce. The first one is data analysis. And AI can use a large data set from the electronic health records, including the patient's information, and it can provide insights for the doctors. Okay, they can use the big data. And then the second one is medical image. And the deep learning can use the medical image for the prediction, and can aid the radiologist in identifying abnormalities. It can help for doctors making decisions from medical image. And it also can enhance the interpretation of medical images. And then the third one is predictive model. And we can use the patient data to make predictive models. It can focus the decision progression and help the prevent care and the better resource allocation. And it also can help doctor to make a decision on patients. Maybe he have the disease or not. And then the final part is clinical decision-making support. The AI system can provide evidence-based recommendations and it can support the clinician in making more informed decisions. And what kind of technique in healthcare? And the first one is image analysis. AI tool can analyze the medical images and can enhance its precision. For example, in the wound management, AI can assess the size and the depth of the wound from the images, and it can provide an accurate and consistent results in treatment. And then the second one is predictive analytics. In the previous slide, we talked about the machine learning, and the machine learning prediction model can predict the disease, and the patient's outcome by analyzing the patient historical and the real-time information. This prediction model can help clinicians or doctors to make a decision or plan for the patients. The third one is natural language processing. The natural language processing algorithm, it can analyze clinical notes and the electronic health records. It can catch the important and valuable information to decision making. And this technique also can enable a comprehensive understanding of patients' histories and the current health status. It can provide a more accurate diagnosis. The next technique is telemedicine integration. AI also can enhance the telemedicine platforms by offering the real-time analysis, including the images or patient's data. The most important part is to benefit the patients in remote or the area which is not easy to serve. In this slide, here's an example for the prediction of a disease. We can use the patient's information, including the vital signs, gene history, and the lifestyle. And we can use the AI technique and use this medical information from the system or big data. And it can to make a prediction model for the specific disease. For example, we can use the vital signs, gene history, and the lifestyle, and combine the machine learning algorithms and to build a prediction model. And you also can evaluate the individual risk and make predictions for the disease. For example, the chronic kidney disease or COVID-19. And medical image is a huge data set in hospital, and you can help doctor to make decisions. In this slide, we can observe that the deep learning algorithms have higher accuracy than humans. And the mean of the error rate of human is about 5% to 10%. However, now the AI technique can reduce the error rate. And the accuracy of image recognition is higher than humans. So we can use the deep learning algorithms and medical images to help doctors to make decisions for diseases. And here is an example. It's a retina and a diabetes. And this algorithm is developed by Google. It can be used to detect the diabetic retinopathy. And in this slide, you can observe, you can use this algorithm can judge this image in 5 levels of DR. This is another image. Each row represents each patient, and then each column represents the technician. In these figures, we can observe that the consistency about 60%. And sometimes they have different technicians, they have different decisions. But if you use the AI, each time the AI can give you the consistent decisions. Now we can observe the F-score. It also shows the algorithm have the higher score than these technicians. So we can use the deep learning algorithm to help doctors and make a decision by using these images. There are a lot of medical images in hospital. And if you can use the AI technique, and what's the benefits in medical images? These images can be detected, interpreted, analyzed, and diagnosed automatically. It can assist the doctor for judgments, and it also can raise the consistency and the accuracy in diagnosis. Of course, if we can use the AI, it can analyze it faster, and also can shorten the patient's waiting time. And the medical images and the AI can reduce the advanced explanations. Now, generative AI is very popular now. A lot of people use the generative AI to deal with their problems. There are two researchers related to ChatGPT, and I know a lot of people like to use ChatGPT. And you need to research that ask ChatGPT which questions are related to medicine. And the ChatGPT can have a higher accuracy, and he can give the data this medical response. So in the future, we can image that the generative AI can be used in the hospital. There are four challenges. The first one is integration. Integrating AI systems with the healthcare infrastructure and require the massive investment and the training. Because we want to have a good AI tool to make decisions, we need a lot of data sets. The second one is the impact on the data privacy. We need to ensure the security of data from patients. It's very important, especially the patient's history and medical information. The third part is regulation. We know the primary data protection is very important. We need to develop approach as a regulation for AI application in medicine. It's it's essential. The fourth part is the impact on doctor-patient relationship. Traditionally, the doctors will explain their decision and recommendation to the patients. In case where AI systems provide some form of clinical decisions, for example, AI recommend diagnosis or interpreting the images. It seems that explaining patients' decision-making is transferred from data to the AI system or the manufacturer. Finally, we make a conclusion. Artificial intelligence is transforming healthcare and various other fields, including the transportation, finance, even agriculture. It can enhance the efficiency while surpassing humans' capability in certain areas. For example, in the golf game, and the AI system can play better than humans. Here, we also encourage everyone to consider how AI can be applied in healthcare to address current challenges. All your questions. Thank you.